This video was created to educate you on the most important information you need from your Orthopedic Associates joint replacement specialist before your upcoming total hip replacement. Orthopedic Associates developed outpatient joint program to allow patients without significant health problems to have their joint replacement surgery performed without having to stay overnight in the hospital. Research has shown that outpatient joint replacement reduces the risk of postoperative infection, deep vein thrombosis, and other postoperative complications. If you have any significant health problems, you should discuss them with your surgeon to ensure it is safe for you to have your hip replacement surgery. Your surgery will take about 2 hours. You will check in at the surgery center when instructed by your surgeon. If you live on Oahu, you can plan on recovering about 2 or 3 hours after your surgery and then being discharged home. For most patients that live on an outer island, you will stay overnight at a hotel or with family on Oahu and then fly home the next day. In some rare circumstances, you may need to stay overnight at the hospital. If you need to stay overnight, transportation arrangements will be made for you. You can put full weight on your operative extremity the day of surgery. You will use crutches or a walker for 1 to 2 weeks. Most people wean from crutches or a walker to a cane or single crutch in the opposite hand of their surgery before gradually walking without an assist device. You will be able to shower the next day, but should not submerge your incision in a pool, tub, bath, or ocean until your surgeon says it's okay, typically about 1 month. Most of the time, your surgeon will use a waterproof bandage, and you can let water run down that bandage. If no waterproof bandage is used, or it needs to be removed early, remove the gauze and tape and use soap and water over the incision the day after surgery. The leg will swell more every day for the first week after surgery. You should elevate your leg as much as possible throughout the day for 2 weeks with a pillow under your heel so your toes are elevated to the level of your nose. It is normal to have pain in your groin, thigh muscles, and around the incision. There will be discomfort and weakness when lifting your leg for about a month. Limit repetitive lifting of your leg for 2 months after surgery. Climbing stairs or riding a bike repetitively can make this growing pain worse. If you swim 1 month after surgery, you should not frog kick or breaststroke for 3 months. You should also avoid extreme movements such as splits, deep lunges, squats, especially in the first 3 months after surgery. It would be best to avoid high-impact exercises like running or jumping for life, because this can lead to your implants wearing out earlier than the 15 to 20-year expected lifespan. Before surgery, you should review your complete medical history with your surgeon or physician assistant. You should ask specific questions about what medications to stop and continue taking before your surgery. There are certain medications that your surgeon may want you to continue taking up until the morning of surgery. There are some medications that your surgeon will want you to stop before surgery. If you take medications that thin your blood, like aspirin, ibuprofen, Aleve, or other non-steroidal anti-inflammatory drugs, you should stop these medications 1 week before surgery. If you take stronger blood-thinning medications like Xarelto, Eliquis, or Pradaxa, they must be stopped 2 to 3 days before your surgery. Warfarin and Plavix must be stopped 5 days before your surgery. Please follow your surgeon's instructions on when to stop these medications. You should stop all vitamins and supplements 2 weeks before surgery. And Tylenol is okay to take until the day before surgery. You will be prescribed several medications leading up to your surgery. 2 of these medications will be used before surgery. You will shower with Hibiclens soap once a day for 5 days before and the morning of your surgery from the neck down, but not your genitalia. Let it sit on your skin for several minutes before rinsing off. You will apply Bactroban ointment into each nostril of your nose with a Q-tip once a day for 5 days before surgery. All the other medications prescribed will be used after. You will be prescribed an antibiotic you will take the evening of your surgery. First dose 6 hours after leaving the surgery center. Second dose 6 hours after that. You will take aspirin for 30 days after surgery to prevent blood clots. If you cannot take aspirin, you will have to take an injection medication called Lovenox for 10 days after surgery. You will take an antacid medicine first thing in the morning after surgery every day for 30 days. Ibuprofen and Tylenol may be prescribed, which can be altered 3 times a day each for pain control. You will be given a few nausea pills that can be taken every 8 hours if needed after surgery. A stool softener will be provided and should be taken every night if you take any narcotic pain medication. A narcotic pain medication may be given to you after surgery. This should only be used for severe pain and not for more than 2 or 3 weeks. If you have any questions, your physician assistant will go over these medications with you. Risks from hip replacement surgery are uncommon, but can include and are not limited to the following. Infection is rare but can lead to additional surgeries to remove the implants, many weeks of IV antibiotics, and redoing the surgery several months later. Prevention of infection is of the highest priority. Prevention with Hibiclens, Bactroban before surgery, and antibiotics after surgery to keep the incision clean and sealed is essential for preventing infection. Fractures of the bone are uncommon, but can happen during surgery, and the bone must be repaired. Dislocation is rare if you do not perform extreme movements. Leg length discrepancy can occur after surgery. To prevent this, much time is spent during the procedure measuring under x-ray. However, if it happens, you may need to wear a shoe lift on one leg. Bleeding risk is extremely low. We do not lose much blood during this procedure, nor do we carry blood in the surgery center. You must be transported to the hospital if a blood transfusion is required. Blood clots can be life-threatening. You will take aspirin or Lovenox after surgery. Lovenox is an injection in the belly fat daily for 10 days after surgery. It is also essential to do the simple exercises you learn in physical therapy every day and do the short 5-minute walks every hour during the day. Chronic pain can occur after any joint replacement surgery, and in extremely rare cases can be worse than pain before the surgery. Loosening of the implants can occur at any time. However, the average lifespan of the implants is 15 to 20 years. If the implants loosen or wear out, the surgery must be revised. This video is one of many patient education resources you will receive before surgery. We know from experience that well-informed patients are less anxious about their surgery and have fewer questions and concerns throughout the surgical process. We strive to provide you and your family members with the proper education about all available conservative and surgical options so you can make a well-informed decision about receiving a total hip replacement. Your joint replacement concierge and surgical scheduler will be with you every step of the way to guide you through the process before and after surgery. We thank you for choosing Orthopedic Associates for your orthopedic care, and we look forward to giving you a new hip so you can regain a pain-free and fully functional lifestyle.